Afternoon, all participants. On behalf of the organizers, I'd like to thank them for giving this opportunity to present this small talk on role of mobile devices in plastic surgery. I thank the organizing committee of the Digital India Week 2022 for this opportunity. So, coming to this, in plastic surgery, there is a wide use of mobile devices, and we regularly use there's a role of internet and technology-based devices in our department for patient care and education. So, to start with, we start with the basic terminology, what we mean by mobile devices or handheld devices. Most of us know these are all electronic devices with computing capabilities, and it has already evolved quite a bit. It started with simple, earlier it was a simple PDA, known as personal data assistant, which didn't have connectivity of the internet, but you could do a lot of storage work and scheduling work over that. That evolved slowly into a mobile phone, simple mobile phone, then which we have the present generation of smartphone. And this smartphone, the larger screen smartphones are known as tablets. So these are the mobile devices which are used. And the software behind it is the mobile operating systems. We have Apple iOS operating system and the Android operating system. Then when we call apps, all of us are familiar with apps. These are software applications which are used in smartphones and which are capable of doing specific tasks. And they may be like native apps which are totally downloaded over the mobile, or they will be hybrid apps, like the app will be over the mobile, but the back-end processing will be going on the internet. Then when we are talking about generations, generation G, that is generations of wireless telecom connectivity, that is 1G, 2G, 3G, 4G, 5G, we started like this. And now the present generation of 5G has taken up, and it basically means the speed of telecom communicability and the amount of data that can be transferred over a connectivity. Then we have this cloud-based services, and there are a lot of cloud servers available where data can be collected and kept, information can be collected and retrieved at required necessity. So when we come to use of mobile devices in plastic surgery, there are two sections. One is in healthcare delivery and the other is in medical education. When we're talking in healthcare delivery, we have basically emergency services and elective services. Digital devices, mobile devices, tablet, and all these are all widely used in both emergency and elective services. And since JIPMER is a teaching institute, we use quite a bit of mobile devices and internet capable devices in medical education also for content delivery and content access. And just for the information, most of the device used were being used prior to the beginning of the pandemic. Earlier also we depend a lot on mobile devices. So this pandemic actually helped in streamlining a lot of things. Basically the communication between the physicians and the patients. So now we have this, when you're talking about healthcare delivery, there are two main important things. One is communication, other is the care. When you're talking about communication, it is between the surgeon and patient communication, surgeon and healthcare worker communication, and surgeon communication. And this can be either text-based communication. This is a very fairly common thing for everybody. Like we send messages on text, SMS, WhatsApp, Telegram messages, or we can do voice-based communication. These are all part of internet communication delivery over the internet. Then when we are talking about care, providing, instituting healthcare, these are mostly through applications, software applications. There are sophisticated applications now developed over this period of time, over the last decade, and they can be used for providing specific care for delivery of healthcare. When we talk about healthcare delivery communication between the surgeon and patient, it is primarily appointment scheduling. A patient wants to know when he is getting operated, or there is a patient has been scheduled, but there is a change in scheduling plans. Then we can intimate over the digital devices or over the internet or telephone, and inform the patient. Then we can advise regarding procedures and medications also over the internet devices. But there are strict guidelines on what kind of advices we can give. We cannot prescribe full medication dosages and all. So it has to be a properly systematic manner we have to advise. Then there is communication between the surgeon and healthcare workers. We have communications between surgeon, the plastic surgeon, he wants to communicate something to the physiotherapist or the nutritionist or the podiatrist. So this kind of communication can happen over internet devices. Then surgeon and surgeon communication, which is the most common in our department also. Like what we do, when somebody goes and attends an emergency case or a elective case, he wants a clarification on the treatment to be given, or there is a doubt about what kind of, which is the best possible treatment. Then surgeon communication is taken over internet devices. And specifically, particularly use the Telegram app for this kind of communications. And analysis of patient care or difficult case scenarios is one part of it. Discussion of treatment plan is the other part of it. Then when we are talking about healthcare communication, there is a small video over this thing. Like we have this application in our mobile. This Telegram app is there. We have different groups, and in these different groups we can get information over the internet, and like this the messages can come. There is JIPMER plastic surgery communication group. Similarly, we have other groups also, like there is emergency group, emergency referrals group, then emergency communication groups are available. Suppose in emergency we can download images, photographs, videos. This came if the patient detail has been given, the surgeon who has attended, the patient has sent the details. We get the information real time. This is synchronous delivery. We get it real time, and then the X-rays can be downloadable. All these images, in addition, the advantages of these images can actually be saved into the gallery and then retrieved later on when required. So we can save the images on the gallery, and when required we can retrieve it. So this is one of the example of how the devices are being used, into mobile devices are used for our delivery, healthcare delivery in our department. Then coming to care, when we are talking about healthcare delivery care, what is mostly the most important part is device. It can either be a tablet device, as you can see in the image. It is easier to communicate with a larger screen device with the patients. And then applications. The primary applications which are available to provide care are diagnosis and treatment recommendations through patient-specific analysis, maintaining patient health records. This can be done through sophisticated applications. Access to evidence-based guidelines, particularly software like UpToDate. These are all available to provide evidence-based guidelines. And then there are devices which can be attached to a mobile phone, and then that can be converted to a separate device. I'll give you an example ahead. So these are four of the usages, types of applications which can be used. Then in plastic surgery specifically, the different spectrums are like teleconsultation, treatment planning, simulator applications, and image analysis. When we mean by teleconsultation, it is basically consultation over the distance through internet or telecommunication media, and particularly for burns, cleft lip, cleft palate, trauma, this kind of teleconsultations can be done. Treatment planning are done in a wide variety of cases like congenital facial deformities, acute wounds, chronic wounds, lymphedema, limb anomalies, and malformations. Then plastic surgery simulator applications are a group of applications where we can actually simulate the changes that can occur in a patient when we decide on operating. Suppose we decide to do a nose surgery, rhinoplasty on a patient. So what would be the changes in the patient that can be actually simulated on a software, like how much will be the change that can be shown to the patient, and patient can make a judgment whether they will go ahead with the surgery or they will not do the surgery. Then intraoperative analysis of digital images and DICOM images. These images are very essential in our day-to-day practice, particularly during surgery, when we want to access CT scan images, MRI images. This kind of images can be retrieved on digital devices, particularly tablets, during intraoperatively during the surgery, and we can proceed with our surgical technique. Then these are some of the examples of some of the apps which we use, and we published quite a bit of studies over it also, like use of mobile devices in medical healthcare and medical education. So a lot of mobile augmented blending, augmented reality. This is a newer variety of applications. They give a sense of augmented reality. And most common communications are obviously Telegram and WhatsApp is the most common mode of communication. These two images show how care can be provided over this software application. These images are there, like the top images of a cleft lip. Markings can be made on the image itself, and this can be transmitted to the operating surgeon. The operating surgeon decides on the surgery. The outcome is visible. Similarly, the lower case for over a the surgeon sends the images to a senior faculty. The senior faculty decides on what kind of surgery to be done, and then that is transmitted back in real time. These all happen in real time. Like there might be a delay of minutes, 2 to 3 minutes, and then once the junior surgeon gets an idea of what kind of surgery to do, they can proceed on it. We have divided mobile applications which are useful for medical, which can be applicable in medical uses into two types, type A and type B. Type A apps have usually the apps which have like additional medical, they're not pure medical uses, but they can be used for medical use. And type B apps are pure medical apps, which this can be textbook apps, this can be medication guides, this can be CME apps, this can be clinical examination apps. Then medical calculators are there, like calculating the amount of fluid which is required in a burn patient. This can be done. Then simulation apps are there. These are type B apps. This is a classification which we devise based on after exploring through the available applications in the domain, software domain. And the educational apps for CME, this kind of educational apps are there. This is Medscape app. And this is note-taking apps are available in mobile where you can take notes and make a note of what are the things we want to plan out, or any surgical technique you have devised, you want to note it, can be noted. And this is a in-house, like in JIPMER, in our Department of Plastic Surgery, we made this app. This is known as the System for Periocular Trauma, SPOT, SPOT app. This is an Android-based app which is for analysis and diagnosis of eyelid injuries, eyelid and periocular injuries. This was devised in our department itself, and we use it for the regular practice. When a patient comes to emergency, the junior doctor enters his data into this app, and the output is received. So this is available for free on Android devices. These are examples of some of the different apps which can be found in most of our devices in medical personnel. This is a device. This is a small device which is attached to either an Android phone or iPhone. This is known as the FLIR, FLIR app, and it can convert the mobile phone into an infrared camera. Infrared has a lot of uses in plastic surgery in the sense that it can identify vascularity of the flap, or it can show the blood flow in a particular limb. If the limb is getting devascular, it can identify. So this kind of attachments can be connected to a mobile device, and immediately it becomes an infrared camera. This is the Osirix app, which is used for analyzing DICOM images and can be used intraoperatively, can be seen on a tablet. For further information about the different types of apps, there's a dedicated website available that is known as iMedical Apps, where we can actually go and see what are the latest medical apps available in all the different branches of medicine. They are divided in disciplinary wise. So a lot of medical apps have now come up, and there is still a lot of opportunity to create applications for software devices. Then coming to other uses in healthcare is for clinical data records. In our department, we maintain meticulous data keeping is done for emergency and elective OTs. This is an example of use of Airtable for data keeping. We use it in our institute, and all the patients who are operated or scheduled for surgery are kept and entered into this mobile-based database. All entries are done on the mobile itself, and then if we want, we can access it on a laptop or a personal computer. All emergency data, elective data, these are the name of the consultants who are there in the department, and these are the name of the senior residents who address the patient. This is the name of the this is the hospital number of the patient. Each of these can be accessed to get all the photographs and details of the patient. So this is a very good use of data keeping apps. Then coming to research, This mobile devices have now evolved. A lot of data collection, research data collection can be done, particularly like EpiCollect and all, where we can collect research information from the OPD itself and complete our research projects. Then information knowledge can be transmitted to different research apps for understanding. One of the other uses in our department is the use of telemedicine through these digital devices. So we have a wide use of telemedicine, and particularly in examinations of the residents, we have devised this objective structured assessment skills. Then when one of the residents in this image, we can see in the central image, one of the residents is using a GoPro camera to do some surgery, and that is telecasted onto the mobile phone or a laptop of the consultant sitting outside the operation theater. Then we can assess the surgical skill of the resident. Coming to other uses, we just discussed about the use in healthcare delivery, both in emergency and elective services. And coming to other uses, we have this in medical education. Since JIPMER is a teaching institute, we senior residents in plastic surgery joined the department, and it is used for teaching them. So this mobile devices can be used for content delivery and content access both. Content access is obviously by the learner. Content delivery is by the resource faculty. Then when we talk about mobile devices in medical education, the primary uses are three things: information management, that is collection and management of information from a lot of resources and transmitting it to the audience. Time management, which refers to time scheduling, when to do it synchronously or asynchronously, that kind of time management can be done on mobile devices. The third is communication between teachers and students, between peers, then between teachers and the medical education team. So these are the primary three uses of mobile devices in plastic surgery. And these are the different digital applications which are available for medical education in relevance to plastic surgery. There are a lot of applications available. So these are like high fidelity atlases are available, and which are used by the residents to understand the anatomy, detailed anatomy of a structure before the surgery, and surgical activities are carried out. Videos libraries are available, operative videos libraries, which can be accessed by the residents, senior residents, the learners. Then when we talk about the resource faculty has a wide role in creating and transmitting educational material. So they have to take the role of, in addition to other existing roles, they have to take the role of a developer, collaborator, and designer. All these things are now slowly part of the medical education process on part of the resource faculty to make the information accessible and enjoyable to the learners. Then the two components of for resource faculty are mainly creating and developing and delivering it to the learners, and these are all developed. Delivering is through mobile devices. It can be synchronous or asynchronous, and creating will be through mobile-based creating can be done, or computer-based creatings are done. The videos can be taken on short videos can be taken on mobile phones, and those technology are being explored now to provide educational material relevant to plastic surgery. Video conferencing is since the onset of the pandemic, video conferencing has become a very it is a very ubiquitous thing everywhere. It has appeared, and it is also part of our regular academic programs. We invite faculties from outside the institute to present lectures to our residents, and we conduct it on a regular basis. And most of the software are free. That is the biggest advantage, benefits of all this thing, and knowledge has no boundaries with the help of video conferencing. Then this is an example of a video conferencing happening in our department with our residents attending and a guest lecture presenting the lecture. So coming to summary of the talk, mobile and digital technology has an important role in healthcare delivery and medical education. Newer generation physicians, most of the new generation, can add to healthcare services by creating digital applications to address public health issues affecting the population. For example, cutaneous malignancies, clefts, burn, acute wounds, chronic ulcers, and congenital and acquired deformities of the hand, face, like that. And further studies are needed well-designed studies, research studies are needed to facilitate adoption of this technology into the art and practice of medicine and surgery. I thank you all for your patient listening.